Hugh gave us the music with no barking, so Shane is contributing. Because that's how we roll. Woof, woof. It's Wednesday, right? It's hump day. Mike, what day is it? What day is it? I never know anymore. I'm not in the office, so generally that's Wednesday.
Remember, you can purchase all of Dr. Morgan's products at her website, www.drjudymorgan.com.
Oh, you're getting waterlogged music?
Relax, and enjoy the show.
Oh, the microphone's not plugged in. Well, you're getting I'm sorry. You're getting the computer mic. Yesterday, my mouse died. This mouse. Today, it's working again. Of course, we ordered a new one, which has arrived, and now this one decided to work. But the way I got it to work was I unplugged my microphone from the computer and plugged the mouse directly into the computer, and suddenly it worked. So I don't know. Yeah, so the computer puts the music underwater. Hopefully, my voice is not underwater. Good day from Australia. That was on our bucket list, along with New Zealand. The bucket list went in the bucket.
There's a hole in our bucket.
There's a hole in the bucket. Yay, 2020. I got my new shirt. I didn't know if it's appropriate for first thing in the morning, but you know, it'll be my Friday night shirt for sure. And I said I was going to buy it in every color they make it in so that I can wear one every day of your African grade shoot your mouse yesterday. All right, the voice is fine. Okay. All right, so we've had a little fun and games around here this week. So a couple weeks ago, Shayna started leaking urine more than usual, which is kind of annoying when you wake up in the morning, even though we have pads on top of the bed where Shayna sleeps. Sometimes she just wiggles her way off of them, and it's really annoying to wake up in the morning with wet feet. It's usually my wet feet because she sleeps on my side of the bed. The good news is I'm kind of short, so I can just curl my legs up and, avoid it, and then in the morning take care of things. Because if it happens on Hugh's side of the bed, we get up at 2 o'clock in the morning and change the sheets. But anyway, he doesn't curl up as well as I do. So I did a urine culture, and she grew 3 really nasty bacteria in her urine, which of course were resistant to everything except injectable amikacin, which is very hard on the kidneys, and she's a senior girl, and chloramphenicol, which can cause some bone marrow suppression, although that was found in humans. So the drug was pretty much taken off the market, and you can only get it through compounding pharmacies. And it was a drug that we used a lot when I first graduated from veterinary school back in the mid 80s. It was a very popular drug. We didn't have that many things to choose from. We had tetracycline, chloramphenicol, amoxicillin, clavamox. That was about it. So we used chloramphenicol quite commonly back then, and really didn't see side effects with it or problems, at least not that we knew of. Of course, maybe we weren't looking for them at that point. Who knows? So since Shayna only had 2 options for antibiotics for this lovely, Australia's on a 2-year lockdown. Since we didn't have many choices to treat this urinary tract infection, and we could tell it was really bothering her. She was asking to go out multiple times during the night when she wasn't leaking. She was asking to go out every 10 minutes during the day. She was peeing in the house. She would go to the door, but she doesn't bark. She just goes and stands there, and if nobody notices, then she pees in front of the door. So, gotta give her credit. So I took the lesser of the 2 evils, and I ordered some good chloramphenicol for her from my favorite compounding pharmacy, Wedgwood. And because this drug has shown problems in humans, it says wear gloves, wash hands after handling, hazardous, handle and dispose of properly. So this is a liquid. You don't want to dump that liquid down your drain to get rid of it because it goes into the waterways, blah, blah, blah. Actually, we should probably talk about how you dispose of medications because it's really difficult sometimes. And we get a lot of medications brought to us at the office after pets pass on, or medications that are left over, and we have to dispose of them properly. Anyway, so Shayna was on it for about a week. I got enough for 10 days. So she was on it for about a week. And Sunday night, she started panting. I can't even call it panting, but her resting respiratory rate was about 100. And I laid there during the night Sunday listening to her and just thought, oh, okay, she's going into heart failure. This is not good. This is not good. So I kind of poked her and woke her up and reshuffled her a few times to get her to kind of stop doing it. And I could get her to stop doing it, and she wasn't coughing. So is this really a heart failure problem? I don't really think it is. Her tongue color was good, but I couldn't quite figure out what's going on. Monday morning, she was still doing it. And I said, that's it. Running her to the office. We're going to get some x-rays and just make sure she doesn't have fluid in her lungs, that she's not going into heart failure. Because, obviously a big concern when you have a dog with pulmonary hypertension and stage C mitral valve disease that she's had for years and years. So ran her over to the office, took an x-ray, big heart, clear lungs. Okay, not heart failure. Abdominal films, fine. Okay, not heart failure, not a big tumor. So then I thought, well, maybe she's just really painful. So after I got back from my wonderful dentist appointment on Monday, I said she's on gabapentin for her SMCM, and she had 50 milligrams in the morning, and she used to be on 100 milligrams twice a day. We dropped her down to 50 twice a day. So I thought, well, it's 2 o'clock in the afternoon. Her morning dose was 6 a.m. with 50 milligrams. I'm going to give her a 100 milligram dose if she's that painful and see what happens. Well, gave that to her, and at 6 p.m. when we went to feed her dinner, she was so loopy from the gabapentin she couldn't even stand up. I said, but her breathing was better. So I said, solved one thing. Now we got a different problem. So we put her in Charlie's wheels so that she could stand up to eat her dinner, but she literally was falling asleep during dinner. So we stopped her gabapentin, didn't give her an evening dose. So mind you, her total dose Monday was 150 milligrams. She used to be on 200 milligrams a day. But since we dropped her down, I guess she's become more sensitive to it. Maybe it was a combination of that and the chloramphenicol. I don't know. She's on so many things. And, but her breathing was really good. And so we finally said, maybe, just maybe, this rapid respiration is a side effect of this antibiotic. It was the only new supplements, but they wouldn't cause it. So I said, you know what? I'm not going to give her the antibiotic anymore either. I don't know if her urinary tract infection is cleared up, but if she's having that kind of a side effect, why would I continue? So we stopped her gabapentin, stopped her chloramphenicol. Here we are 36 hours later. Since we stopped everything, this dog is back to her normal, happy-go-lucky, you heard her barking, self. So when you start a new medication with your pet, whether it's a supplement or an antibiotic or a heart med or something for kidneys, blood pressure, whatever, you need to be really paying attention to what they're doing, because any animal, any person can have a side effect, and it can be a weird side effect. When Shayna was so weak Monday night, I had to get out my formulary and look up and see, could chloramphenicol cause that muscle weakness? And it's not really listed as a side effect. Neither is rapid respiration. So I really think the weakness was the gabapentin, because that is definitely a side effect of that. But, when you have something weird going on, don't ever hesitate to question. You can go online and you can put a drug in a search engine and you can look for all the side effects. And just be aware that most of the side effects that you're going to read about are going to be in humans. And not all human side effects will translate over to dogs. For instance, one of the fluoroquinolone antibiotics that we use, Baytril, enrofloxacin, It was originally looked at for humans. They can't use it in humans because it causes people to become jaundiced. They turn bright yellow on that drug. In dogs, not a problem. And we generally don't see liver enzyme elevations. So they metabolize it totally different than people do. So I would recommend, if you're looking for side effects of a particular medication, that you put that in your search engine. You know, side effects of Baytril in dogs, side effects of chloramphenicol in dogs or in cats, whatever animal you're using it on, because it will be different. And you may or may not find anything that matches what you think you're seeing. So then I would look at side effects in humans and see, because obviously we have more research on medications in humans, if it is a human medication. So this was interesting. I haven't found anything in my books or on the internet saying that chloramphenicol could cause what we saw with her, but stopping the drug stopped the problem, or the extra gabapentin broke a pain cycle that she was in. I don't really know, but I'm too scared to put her back on the antibiotics, so we're not going to do that. So research everything now, and I mean everything. So yeah, I mean, and this is, it's what we do when a drug rep comes to us and wants us to try a new medication. The first, I don't look at how great and wonderful and what it does. First thing I look at is, what were the, how many animals was it tested on? What were the side effects? I want to know the side effects before, you know, you can tell me all the good stuff in the world. I don't really care. I want to know what's the potential for harm for a particular drug. So that's where I go first. So I get out that long drug insert that has, you know, little teeny tiny print that I have a hard time reading anymore. By the way, I used to, my mom used to have this lighted magnifying glass that she would use to read things before she had her cataract surgery. And I don't have one of those. Actually, I found one in my desk drawer when I was cleaning out the other day, but I threw it away because the light didn't work anymore. But if you take your phone and put your flashlight on and then put it on camera and then zoom in, you can magnify anything. And we all have our phones with us all the time. So that is my lit up magnifying glass that works really well. My little trade secret. So, okay. All right, everybody, have a wonderful day. Does black junk that comes out of a dog's ears mean fungal bacteria or mites? How can you tell? You can only tell by looking at it under a microscope. There's no other way to tell. Ear mites are not very common in dogs. Generally, ear mites are going to be a granular black, and when you touch the ear like this, they're gonna, ear mites are so itchy, so itchy. Yeast is pretty itchy, generally has a sweet smell. Bacteria generally has a bad smell. Yeah, I don't know if that's going to help or not. But you really need to look under a microscope. That's the only way you're really going to know. Yeah, Kim, in general, hawthorn and vetmint can be given together. Go slow with it. Yeah, vitamin C would be great for urinary tract infection, except that Shayna gets diarrhea at the drop of the hat. So that would be a tough one. I'd have a different problem to deal with.